Okay, in this video, we're going to talk about tissue repair, developmental aspects, and aging. In terms of tissue injury and tissue repair, when the body's barriers are compromised, there's an inflammatory and immune response that's formed, and this actually helps to set the stage for repair pretty quickly. In fact, repair is the function of the inflammatory process. So this is the first step of tissue repair, is inflammation. So in terms of looking at tissue injury in a stepwise manner, or repair rather, what we find is that in response to initial injury, let's say a wound, a superficial wound on the skin, inflammation really sets the stage here. Where essentially what happens is that in the surrounding tissue near the site of injury, these cells can release chemicals, which we call inflammatory chemicals, and these actually cause an attraction of immune cells to the site of injury. Now, what these immune cells do is essentially help to remove debris or foreign microorganisms that may have been introduced to the tissue itself. We find that local blood vessels also become more permeable, that allows for nutrients to leak out into the tissue as well as other immune cells, and clotting factors that can actually help to form a scab or blood clot here. Now, once clotting occurs, the surface that's exposed to air dries and then forms a scab to cover the injured area of tissue. Now the next step here is that we actually have some additional organization that can restore blood supply so that new blood vessels can grow towards the site of tissue injury. We get fibroblasts that actually are attracted to the site of injury and they lay down new connective tissue proper. Macrophages nearby help to phagocytose or remove debris, and then surface epithelial tissues start to redivide and then basically form a new barrier at the apical level here. Now the last step here is we actually have regeneration and fibrosis that eventually lead to the formation of scar tissue. So we have regeneration of the epithelium, regeneration of the underlying connective tissue. The reason why we call this a scar is that the new tissue isn't well formed with the surrounding tissue, so it's going to have its own sort of characteristics structurally. And this is actually visible at the skin surface where you might have a depression or an elevation in the tissue here because of this scar tissue. Now over time what happens is that the surrounding tissue starts to match this new tissue here, and it all evens out, and so it's hard to tell the difference then between the new and old tissue. So in terms of regenerative capacity of different tissues, unfortunately not all of our body's tissues can regenerate as well as others. Some tissues that have really great regenerative capacity include epithelial tissues like your skin or your digestive tract, bone, areolar connective tissue or dense irregular CT, as well as blood-forming tissues. These ones regenerate very quickly, and upon injury they can restore themselves fast. Now tissues that have moderate regenerative capacity would be things like smooth muscle or dense regular connective tissue. And those with virtually no functional regenerative capacity include cardiac muscle and nervous tissue. With cardiac muscle injury, these cells don't really regrow. Essentially what happens is that the dead cells are removed and scar tissue remains where there used to be living cells. And similarly with nervous tissue as well, where dead cells are removed and there's large spaces that remain in the nervous tissue where there used to be living cells. And this is true of both the brain and spinal cord, which is why brain, spinal cord, and heart tissue injury typically don't have the best outcomes because they have poor regenerative capacity. Now, new research does show that cell division can occur in some of these tissues, and certain efforts are underway to kind of coax them with growth factors to regenerate better. That way, if someone has a stroke in their brain, you might introduce growth factors to regrow some of the surrounding cells and hopefully regenerate or restore function. Now, in terms of developmental aspects of tissues, it turns out that during development, our tissues are really derived from three primary germ layers. And by germ, we kind of mean to give rise to. So these three layers occur early on in embryonic development. We have ectoderm, mesoderm, and endoderm. It turns out that ectoderm gives rise to things like your nervous tissue, skin, as well as epithelial appendages like hair, sweat glands, nails, and teeth come from ectoderm as well. So we say that the cells that you find in this layer, embryologically, ectoderm, give rise to nervous tissue and other tissues as well. But if someone has a dysfunction of this primary germ layer, then effectively they'll have deficits in nerve tissue growth, maybe even hair, nail, and teeth growth as well. Now, mesoderm gives rise to muscle and connective tissues, and epithelial tissues come from all three germ layers. So what this looks like here is essentially a 16-day-old embryo. So at 16 days after fertilization, we see that the cells line up in three major layers here. We got ectoderm, mesoderm, and endoderm. Remember, ectoderm gives rise to mostly nervous tissue as well as skin and nails and hair and teeth. Mesoderm gives rise to muscle tissue as well as some of the other connective tissues. And then endoderm forms the inner lining of the digestive system. Now, an example of this would be like the epithelial tissues that line your digestive tract. When this folds, you end up having a tube in the center, and these cells end up forming that barrier that separates the inside of that tube, your digestive tract, from the rest of your body, which are these deeper layers here. Now, in terms of sort of age-related changes of our body tissues, we say that tissues function fairly well through youth and middle age as long as there's adequate diet, circulation, and infections are minimal. Now, as our body ages, we see a general thinning of epithelial tissues, so they're more easily breached and damaged. If you look at the skin of elderly individuals, their skin is so thin that it doesn't take much trauma to cause a tear or rupture in their skin barrier. Other tissue repair is also less efficient as we age because there's just less cells available, and those cells are even more slowly metabolically active, so that we don't really repair our tissues as quickly. Bone, muscle, and nervous tissues also begin to atrophy. So an example of bone atrophy would be osteoporosis in aging. We also see some atrophy and loss of muscle strength. And nervous tissue atrophy can lead to things like dementia, neuromuscular weakness, and other sensory neural deficits as well. Now, DNA mutations we can actually accumulate over the course of our lifetime, and ultimately this increases our risk of cancer. So as we get older, the risk of cancer increases dramatically.